Hi everyone, here I am giving some brief introduction to forensic medicine, which might be helpful for you. And what is forensic medicine? Is application of medical knowledge to aid in the administration of justice. It's called as forensic medicine, also known as legal medicine. And what is medical jurisprudence? Is legal responsibilities of a physician with reference to those arising from physician-patient relationship. That is medical jurisprudence, and medical ethics is moral principles which should guide the members of the medical profession. This is medical ethics. Medical etiquette is conventional laws of courtesy observed between the members of medical profession. That means I am a doctor. If I got some illness of my ear, I have to consult an ENT doctor. So I'll go to ENT physician, and usually if a normal person goes, he will charge something. And if I goes, what he has to do is he don't have to charge any fee for me because I'm a doctor and he's also a doctor. So that is called, he don't charge the fees for me. That is called medical etiquette. And here you have to remove some names of some previous old scientists. Of those, first is D. Varignana, who did his first autopsy, and first autopsy is done by D. Varignana. And next is Paras Chachias, who is the father of legal medicine and forensic psychiatry. He also contributed a book that is Questions Medico Legales, and it is also written by Paras Chachias. So he is the father of legal medicine and father of forensic psychiatry. And next is Orfila, who is founder of modern toxicology. Father of modern toxicology or founder of modern toxicology is Orfila, whereas Paulus Chachias is father of legal medicine and forensic psychiatry. And now we will go to IPC and CRPC. What is IPC? IPC is Indian Penal Code, which defines the offences and even prescribes the punishments for those offences. That is Indian Penal Code. Next is CRPC. CRPC means Criminal Procedure Code. What CRPCs do is they provide mechanism for punishment of offences. Mechanism for punishment is given by CRPC, where punishment, definition of punishment is given by Indian Penal Code, that is IPC. So you have to remember these 2 points from there. And one more is Indian Evidence Act. I didn't mention here. Indian Evidence Act categorizes the evidences and even preservation of the evidences, collection of the evidences. These things are done by Indian Evidence Act. That is IPC and CRPC and the Indian Evidence Act. Next is civil law and criminal law. What is civil law? Civil law is observed between two individuals or two parties. That is, if a fight or something happened between two individuals, that will go to civil. That is a civil case. And criminal cases, if someone done any offense against the public interest, that will come under criminal case. Criminal case such as murders and bank robberies. There are so many things and comes under criminal cases. Whereas civil is between two bodies or between two individuals is civil. Now you have to remember two definitions, that is plaintiff and defendant. Plaintiff is the party who bringing the action, or a person who bringing the action is called as plaintiff, whereas defendant is accused in cases. That is accused person is the defendant. He has to defend himself, so he is called as defendant. And cognizable offense. Cognizable offense are those offenses in which a police officer can directly arrest a person without any warrant from the magistrate. Usually, if you want to arrest a person, what the police should do is he has to get some warrant from the magistrate to arrest the person. But in these cases or in these offences, a police officer do not need any kind of warrant from magistrate. He can go directly and ask that person. Those offences are called as cognizable offences. The examples of cognizable offences are rape, murder, dowry death, and even dragging and even negligence. So these will come under cognizable offences: rape, murder, dowry death, ragging, and negligence. And side, which is inquest. What is an inquest? Inquest is inquiry or investigation into the cause of death. Inquiry or investigation into cause of death is called as inquest. Inquest or inquiry can be done in cases of unnatural death, such as suicide, homicide, or accidents, or occupational death, or deaths due to medical negligence, and animal attacks or suspicious deaths. So, any unnatural deaths, what we will do is we will inquire or we will investigate the case how the death has happened. So, this is called inquest. There are two such inquests. One is police inquest and another is magistrate inquest. Police inquest comes under 174 CRPC. Usually SI will conduct the inquest, or SI or some inspector also can do the inquest in presence of two or more respected persons, which are called as panchas, and prepares the inquest report, that is panchanama. What is panchanama? Is the inquest report, nothing else. So that is police inquest. You have to remember here is 174 CRPC. 174 CRPC is for police inquest, and for magistrate inquest it is section 20 to 23 CRPC. I have mentioned here magistrate inquest can be done in some cases such as death in police custody, or death due to police firing, or death in prisons, or deaths in psychiatric hospitals, dowry deaths, and even exhumation. Exhumation, I will give some points after some time. And this magistrate inquest, in any case of death, a magistrate can conduct an inquest instead of or in addition to police inquest. So, in any case of death, a magistrate can conduct an inquest. But in these cases, I will tell you now, magistrate inquest is a must. That is, death in police custody, or death due to police firing, or death in prisons, or in reformatories, or death in psychiatric hospitals, or dowry deaths, and even exhumation. In these cases, magistrate inquest is must. And what is exhumation? Exhumation is digging out of a buried body. Exhumation can be done in if there is a suspicion, or if you want to do autopsy again. Suspected cases, usually we will do exhumation in suspected cases. What we will do is we will bury out the body. Sorry, we will dig out the body which is buried, and if needed, we will do send it for autopsy. So that is exhumation. I will tell some points later also about this exhumation. And next is coroner's court. Just remember one point: coroner court is a court of inquiry, not a court of trial. Just remember this point from coroner's court. That will be enough for now. And here I am going to give some different kinds of courts and the punishment given by them, and even the fine awarded by them. Second class magistrate, first class magistrate, chief judicial magistrate, assistant sessions court, high court, supreme court. Second class magistrate can give an imprisonment, that means jail, for 1 year and a fine of rupees 5,000 rupees. And a first class magistrate, up to 3 years imprisonment can be given, and a fine of rupees 10,000 rupees. and Judicial Magistrate can give an imprisonment up to 7 years, and the fine is any amount that he want. And Assistant Sessions Court, imprisonment up to 10 years and any amount of fine he want. Sessions Court, any sentence authorized by law and any amount of fine. And even High Court and Supreme Court the same, any sentence can be awarded. But here you have to remember one thing about Sessions Court. What the Sessions Court do is, Sessions Court can announce death sentence. That means he can award death to the offender. But the death sentence must be confirmed by High Court. So Sessions Court can give an death sentence, but it should be confirmed by High Court. And other than that, High Court and Supreme Court can award any sentence and any amount of fine they they want. High Court and Supreme Court do not hear the trials. That means, 1 minute. High Court and Supreme Court only hear the referrals, that is referred by the previous courts, but not the trials. Trial means direct case. They don't take the direct case, but they only take the referrals. So that is about the courts and their imprisonment and fine. Came to next slide. Juvenile magistrate. Juveniles are boys under 16 years of age and girls under 18 years of age are considered as juveniles. Juvenile Magistrate Board, in this one, Metropolitan Magistrate or first class judicial magistrate are present, and even two social workers. Out of those two, at least one woman should be there. So just you have to remember these years. Boys less than 16 years and girls less than 18 years are considered as juveniles. Metropolitan Magistrate or First Class Magistrate is present in the Juvenile Justice Board along with two social workers. Out of those, at least one woman should present. And medical evidence. Now the medical evidence may be documentary or oral or direct evidence, indirect evidence or hearsay. Documentary evidence is written evidence, that's medical certificates, medical legal reports, or dying declarations. These will come under documentary evidence. Whereas oral evidence, by oral, here the oral evidence is superior to any other evidence because oath is administered and cross examination is done. So, oral evidence is superior. Just remember this point, oral evidence is superior. And indirect evidence. Direct evidence is evidence of a person who have been seen or heard or perceived the fact. Indirect evidence or circumstantial, that is hearsay. Indirect or hearsay are the both are the same. In this, witness states that he has heard others saying. He has heard others saying. Other two persons are discussing about this case, but he heard from others that it has happened. So that is called hearsay. Direct evidence is the person is present or seen the crime. That is called direct evidence. Whereas indirect is he has heard from someone discussing the topic. So that is called indirect evidence. Oral documentary we already had, but oral is superior. Just remember this point. Oral evidence is superior to all these. And hostile witness. Hostile witness is who conceals a part of the truth. That is, he don't tell exactly what happened there. He might conceal some part of the truth, or he might add something else into the truth, what has happened there. He is called as hostile witness. Hostile witness comes under section 191 IPC, which is very important. Here I have mentioned two IPCs, that is for hostile witness and one for perjury. Hostile witness, it is 191 IPC, and perjury is 193 IPC. Perjury is giving false evidence. So will give false evidence, that is called as perjury. Just remember this 193 IPC from perjury. And hostile witness who conceals a part of the truth or completely gives a wrong statement, that is called hostile witness and perjury. Just remember the IPCs which are important in this slide. We are going to next slide. Oath. Just remember one point, that is child below 12 years of age are not required to take an oath. And now direct examination, cross examination, re-examination, and examination by judge. Direct examination is or also called as examination in chief. In this direct examination, no leading questions are asked, whereas in cross examination, leading questions are asked to elicit the facts that the question that the witness is telling the truth or not. That is cross examination. Next is re-examination. Just remember, in re-examination also there are no leading questions are asked. And examination by judge. Judge can ask any question at any time. Just remember this point in examination by judge. Next is dying declaration. What is dying declaration? Dying declaration comes under section 32 IEA, that is Indian Evidence Act. Dying declaration is done when the suppose a person is in serious condition. We can take a dying declaration from him. A magistrate can conduct an inquest. In dying declaration, no leading questions are asked and no oath is administered. Here some spelling mistake is there. Let's correct it. No leading questions are asked and no oath is administered in dying declaration, and it has corroborative value when the person survives. If the person survives, the dying declaration which we have taken had some corroborative value, which will add some evidence to the truth what he is telling. So if the person survives, it is also helpful. No police officer should present at the scene while taking the dying declaration. Anyone can take dying declaration if there is no time for the judge or for the magistrate to come to the scene. In that case, anyone can do this, but in the presence of uh, two two persons, so anyone can take the dying declaration when there is no time for the judge to or for the magistrate to come to the scene. So these are some important points regarding dying declaration. And next is dying deposition, which is not followed in India. In dying deposition, oath is administered and cross-examination is done. So that's why this is not followed in India, because of some ethical values. But dying deposition is superior to dying declaration, but not followed. Just remember, oath is administered and cross-examination is. Now, Indian Medical Council and State Medical Council. Functions of Indian Medical Council: it maintains the medical register, maintains the standards of medical education, recognition of foreign medical qualifications, and appeals against disciplinary action, warning notice, list of practices which are considered as professional misconduct. So, warning notice, disciplinary action, educational standards, maintenance of medical register, recognition of foreign medical qualifications. And what are the functions of state medical council? The same: maintain medical register, maintain education standards, but penal erasure and disciplinary action. What is penal erasure? Penal erasure or professional death sentence is the removal of name of the doctor from the medical register. Main cause is serious professional misconduct or infamous conduct done by a doctor. In those cases, the state medical council removes the name of the doctor from the register. That is called as penal erasure or professional death sentence. If the doctor has done some serious professional misconduct or infamous conduct, he is removed by the state medical council. Just remember this point, which is important: penal erasure done by state medical council. Several times asked in examinations. And next is dichotomy. Dichotomy is called fee splitting. Just remember this: dichotomy is fee splitting. If I want to tell you some example, like some pharmacies or some other surgical materials, they will offer some money or some gifts to the doctor if he allows their products to sell. So that is dichotomy, fee splitting. Next is adultery, is sexual intercourse other than with spouse. That is adultery. Voluntary sexual intercourse with a person other than his or her spouse. Covering is if doctor is not present and if there is any case in the hospital, what he will do is he will ask some other person who is not qualified to do that procedure. That is covering. It is called as covering. Even that is a negligent act by a doctor. And professional misconduct. There are 6 years of professional misconduct that are adultery, abortion, association, advertising, addiction, and alcohol. These 6 years are considered as professional misconduct. Doing abortion or adultery or association with some other person, and advertising and addiction and even alcohol consumption. These will come under professional misconduct. Alcohol consumption, what he will do is he will drink and go to the OT or some go to IP, OP. That is called what he is doing is called as a misconduct, professional misconduct. Criminal negligence, contributing negligence, medical maloccurrence. Criminal negligence is gross absence of skill or lack of skills is called as criminal negligence. That means some examples like amputation of wrong finger. He has to cut, he has to amputate the second finger of the right hand, but if he amputates the left hand's finger, that is that will come under criminal negligence. And even leaving instruments or leaving swabs in the abdomen and doing suturing, so this will come under criminal negligence. You will be seeing this scene in many movies, like he doctor will leave some instruments in the abdomen of other patient, so that will come under criminal negligence. And contributor negligence, along with the negligence of the doctor, if the patient or patient's guardian is negligent, it is called as contributory negligence. Patient or his attendant is also negligent by non-cooperating with the doctor. So this will come under contributory negligence. Next is medical maloccurrence. Medical maloccurrence, also called as act of God. In spite of good medical attention and care, in some cases an individual fails to respond properly or may suffer from adverse reactions of the drug. That is called medical malpractice or act of God. The doctor has good knowledge and he gave good proper care to the patient, but even though there are some adverse reactions of the drug which are not controlled by the doctor, that is called as medical malpractice. Examples are like breaking of needle during intramuscular injection due to sudden muscular spasm. This sudden muscular spasm and the injection has been broken. The doctor can't do anything in that case. He can't control that muscular spasm, right? So, sudden muscular spasm, injection and needle is broken. It will come under act of God or medical malpractice. And damage to RLN, recurrent laryngeal nerve, which is commonly damaged during thyroidectomy. So in that case also doctor can't do anything. Even he is having some good care, even he is having some good skills of operating, but RLN is most commonly damaged during thyroidectomy. In this case also doctor can't do anything, and this is called medical malpractice or act of God. Offenses against negligence are maintaining proper skills and existing treating the patient according to the existing standards of the profession, and contributor negligence. If the patient along with our patient's attender is also negligent, then he can doctor can defend the negligence. And intervention of third person with the doctor unknowingly, that means doctors don't know that third person intervened in between and the case has spoiled. In that case also doctor can defend himself. And therapeutic misadventure, that is unintentional therapeutic misadventure, that is unintentional act by doctor, such as hypersensitive reaction or anaphylactic reaction by penicillins or aspirins. And another is medical malacquerence. I have told you just before about medical malacquerence. Contributory negligence is not a defense against criminal negligence. If he did some criminal negligence, he is criminally sorry. Contributor negligence is not a defense against criminal negligence. Just remember this point. Paternalism is abuse of medical knowledge. Vicarious liability is employer is responsible for the act of employees. That is, if I appointed some three other persons as my assistants or some other persons, that in that case I am responsible for what they did. So that is called as vicarious liability. And paternalism is abuse of medical knowledge to distort the doctor patient relationship. So that is paternalism. Medical records, inpatient records should be maintained for at least 3 years of duration. And if you think there is some rise of medical issues, like some if there is rise of negligent act by doctor, if they rise something against you, then in those cases, if you think there is a chance to rise the negligence act, in this case you have to preserve those records for 25 years, and MLC records should be preserved for 10 years. Medical legal cases, those records should be maintained for 10 years, and after the death of the patient, the records should be at least maintained for 3 years. So these are various time durations of maintaining records. And the consent. Consent means voluntary agreement or permission. It is given by patient. So voluntarily agreeing for the procedures you are doing. So that is called as consent. Two types: implied consent and expressed consent. Expressed consent is whether it is written or verbal. Implied consent means you are going to give an injection to the patient, and he automatically gives his hand. So that is called implied consent. That is he is implementing. That is he is the patient on his own is giving his hand to you by seeing injection in your hand. So that is called as implied consent, whereas expressed is whether written or verbal. Next is oral consent, written consent, blanket consent. Blanket consent is taken at the time of admission for all the procedures. That is blanket consent is for all the procedures at a time. But blanket consent is not a valid consent. Oral and written are valid, and loco parentis. What is loco parentis? Is a child under 12 years cannot give a valid consent. That's why if a child is staying in some hostel or some school, so at that time the parents are not available. So if he is having some injury or some having some serious condition, he is transferred to some local hospital and the doctor will see and he has to treat. Further, the doctor ask him for consent, but a child under 12 years cannot give a valid consent. So what in this case, what they will do is the in charge person of the child, that is in charge of the child at that time, that is with the school headmaster or the school teacher, he can give valid consent to treat that child who is under 12 years of age. So this is called loco parentis and blanket consent for all the procedures, but it is not valid written and oral consent. Acts: Human Organ Transplantation Act, Workmen Compensation Act, Protection of Human Rights Act, Consumer Protection Act. Human Organ Transplantation Act is made in 1994, Workmen Compensation Act 1923, Protection of Human Rights Act 1993, Consumer Protection Act 1986. Let's remember some points from Human Organ Transplantation Act. Remember one point from Human Organ Transplantation Act or the Transplantation of Human Organs Act. Both are the same. Just remember this point: bone marrow transplant is outside the purview of this act. Bone marrow transplantation do not come under this act because according to this act it defines the human organ as any part of the body consisting of structured arrangement of tissues which is wholly removed, cannot be replicated. Any part of the human body consisting of structured arrangement of tissues which is wholly removed, cannot be replicated. But what will happen with the bone marrow is after removing some part of the bone marrow, even after that bone marrow can replicate. So that's why bone marrow transplantation cannot come under this act. Now euthanasia. Euthanasia is mercy killing or assisted suicide. I think you had heard this word before. Mercy killing or assisted suicide. It is not an assisted homicide. Remember, it is assisted suicide. It is of four types: active euthanasia, passive euthanasia, voluntary, and involuntary. Active euthanasia is act of commission. That is, you are giving some large dose of drug to, yeah, what you are doing is you are giving some large amount of drug in active euthanasia. That is, you are committing that, so it is called as act of commission. You are giving large dose of drug to hasten the death. So you are giving, so it is act of commission. You are committing. Next is passive euthanasia, or also called as negative euthanasia, which is act of omission. That is, no specific medicine or life-supporting measures are given. Death induced by discontinuation of life-sustaining measures. That is, if some patient is on ventilator, you are disconnecting the ventilator so that you are hastening the death. So it is act of omission. You are omitting it. That is, you are stopping that. ventilator, you are removing that ventilator, so that's why you are hastening the death of the patient. This is called as passive euthanasia. That here you are not giving any drug to the patient. In active euthanasia, you are giving some drug to the patient to hasten the death. Next is voluntary euthanasia. Voluntary euthanasia may be senile people or patients suffering from incurable disease or due to senility. What they will ask is they will ask the doctor to terminate their life. That is called voluntary euthanasia. And involuntary euthanasia. Involuntary euthanasia is done when the patients are unable to express their wishes. That is, a person with irreversible coma or severely defective infant. In those cases, they can't express their wishes, so it is done by their relatives, patient's relatives. So it is involuntary euthanasia. Autopsy. I think you are well known about this word. Clinical autopsy, medical legal autopsy, virtual autopsy, psychological autopsy. Clinical autopsy or pathological autopsy. In this, you must need the consent from the relatives of the patient. So, a consent from the relatives is must needed for clinical or pathological autopsy. In medical legal autopsy, consent from relatives is not necessary. You can directly do autopsy without the permission from the relatives. Next is virtual autopsy, also called as autopsy, is done with the help of CT or MRI. So it is called as autopsy or virtual autopsy. Next is psychological autopsy, which is different from the first three things. The psychological autopsy is a procedure for investigating a person's death by reconstructing what the person thought or felt or did before the death. So it is by analyzing, you will ask his friends or his relatives or his neighborhoods what has happened before the time of death. So that is psychological autopsy. You are estimating the psychological potential of that person. So it is called as psychological autopsy. It will help you to give the reasons of his death. Techniques of autopsy, Virchow's techniques, Rogatansky technique, Lutelis technique, and Gauss technique. Virchow's technique, I think, is the most common type of autopsy done, and Rogatansky technique. In Rogatansky technique, in situ dissection is done. In situ dissection is done in Rogatansky technique. Lutelis, in Lutelis, all attachments are intact. Just to remember these 2 points. In situ dissection done in Rogatansky, and all attachments are intact in Lutelis technique. And another is Gauss technique. In Gauss technique, all the organs are removed in organ blocks. Organ blocks. So next is air embolism. In air embolism, head should be opened first, and the surface vessels of the brain are examined for gas bubbles. And next point is left ventricle is filled with froth if air is present in sufficient amount to cause the death. So these 2 points are important. Head should be opened first in air embolism, and left ventricle is filled with froth in air embolism. Just remember, they will ask left ventricle, right atrium, left atrium. So you have to go for left ventricle. And next is parogalal test. Air is brought in contact with alkaline parogalal solution, which turns brown, indicates antemortem air embolism. It is to detect whether it is antemortem air embolism or postmortem air embolism. In antemortem air embolism, the parogalal, which turns into brown on exposed to air, that is gas bubbles. So which is a important test. And the next is some obscure autopsy and negative autopsy. Obscure autopsy means if there are minimal or indefinite or obscure findings, it is called as obscure autopsy. Negative autopsy is when you grossly examine the when you closely examine the dead body, and even though you can't find any reason why the patient is dead or what is the reason for the death, that is called as negative autopsy. Whether obscure autopsy is when there are obscure findings or minimal findings is called as obscure autopsy. Artifacts. What are artifacts? Artifact is any change caused or feature introduced in a body after death. That is, any change caused in a body after death is called as artifact. Economic artifact, that is regurgitation or esophagogastromalacia, and even artifacts during resuscitation. Injuries due to defibrillator application or cardiac massage or central line or positive pressure ventilation or laryngoscope. These will come under resuscitation artifacts as these artifacts are introduced during resuscitation, so called resuscitation artifacts. Secondary artifacts are regurgitation and esophagogastromalacia. Even I don't know exactly about these secondary artifacts. And the artifacts due to handling of the body. During the handling of the body, undertaker's fracture, postmortem operations, which come under handling during handling of the body, artifacts during handling of the body, and burns. Heat rupture or heat hematoma will come under burns artifacts. And during autopsy, that is skull fracture, visceral damage, and head bone fracture. Head bone fracture, skull fracture will come under during autopsy artifacts. So if there is any mistake, you can please correct it and tell me back. So thank you very much.